Greetings. Let us talk about bougie dilation for esophageal stricture and a bougie dilation without the use of a guide wire. So these are my acknowledgements, and today we will learn the use of a bougie dilator without a guide wire and how to set it up and use it in the clinic, and also how to help a patient do self-dilated bougie dilation. So when you look at it, we have different type of bougie dilators. Bougie dilators without the use of a guide wire and bougie dilators with the help of a guide wire. And today we will talk about bougie dilators without the use of a guide wire. And these dilators are available in sizes from 20 to 60 French. 3 French is about 1 millimeter. So 60 French is about 20 millimeters. So these bougie dilators are typically used for simple strictures with a minimum diameter of at least 10 millimeters in size. So let us look at some simple strictures where bougie dilators can be used. Here is a simple stricture, and this is Schatzki's ring that is at the lower end of the esophagus, a simple short membranous web or simple stricture. So this can be dilated with a bougie without the use of a guide wire. So this stricture can be managed. Here is another stricture that is a simple stricture, an esophageal web, and this also can be dilated with a bougie without the use of a guide wire. On the other hand, here is a complex stricture, tight and long, and if it could be angulated also, it is complicated stricture or complex stricture, and these strictures should not be dilated without the use of a guide wire. So if you use a bougie without a guide wire and you try to dilate a complex stricture, you're likely to cause problems, as the bougie tends to curl above the stricture and can rupture the esophagus. So having learned about where to use and where not to use a bougie dilator, let us look at different types of bougie dilators. There are 2 types that are available, Maloney dilators and Hurst dilators. And depending upon the tip, if the dilator has a tapered tip or a blunt tip, they are either called Maloney or Hurst dilators. And as we talked about, these dilators are available in sizes from 20 French to 60 French. And when you set up a dilator for esophageal dilation, you should ask the endoscopist what sizes is he going to use. Typically, he knows the type of stricture is managing from prior experience, and he may say, hey, get a set starting from in the 50s or 60s French, or he may say a different size. So important to find out, and you get at least 3 or 4 sizes. You also need a lubricant and a gauze to put the lubricant. When it comes to dilation, the first step is to lubricate the tip, and not necessarily lubricate the whole dilator, and don't want to get this lubrication on the glove because it will slip. So gently put the lubricant at the tip of the dilator close to the mouth guard, and if need be, put a little more as the procedure is going. And the endoscopist will gently insert the dilator into the mouth, and after a few millimeters, he has to go down the hypopharynx. It is almost like at a obtuse right angle. And in order to facilitate that, it is a good idea to extend the neck to make that pathway relatively straight as the endoscopist gently inserts the dilator down the esophagus. And when he feels the resistance, he will gently push to dilate the stricture. Once the dilation is done, he may push in and out, and then once he's happy, he will gently withdraw the dilator, and you should be, as an assistant, be ready to take the dilator and give the next dilator. So when it comes to dilation, pick the sizes of dilators that are needed. Be ready with a lubricant to put it at the tip of the dilator, and try to help the endoscopist by gently extending the neck to facilitate the insertion, and so that the procedure goes smoothly. So let us see what happens inside. Here is an esophageal stricture, and the dilator goes through that stricture, dilates the area, and then you pull that thing back. So if a patient is coming from far off and he requires dilation once in a very few months, and the stricture has been pretty well dilated before, and he wants to dilate the stricture himself at home, the nurse usually educates the patient how to do self-dilation. And there are videos that are available on the YouTube that you could watch. But the principles are here. For self-dilation, again, you sit or stand and lubricate the dilator. And as you insert down the neck, you extend the neck so as to straighten that pathway. And you gently push it down till you dilate, and then come back and push it down and come back and then take it out. Usually patients are given a single dilator size to keep the stricture open and avoid the need to come to the hospital. And this is done for patients with a simple stricture with a relatively wide bore of opening, not for complicated strictures, and not for patients who are not motivated to do this. And patients need to be educated about proper way of dilation, and this is typically done in the hospital setting under the observation, so that the patient is comfortable before he can go home with a dilator that he can use at home. I hope this is useful. Thank you.